So I've been using ChatGPT to become a better educator at the bedside with residents and med students, and it might not be in the way that you might expect. I have not done this long enough to have a bevy of like 700 different topics that I can just go into a 10-minute chalk talk off the cuff. So to make up for my lack of gray hairs, I use ChatGPT as like my first student that I practice a talk with. So if I want to cover things like, hey, what are the different 6 causes of hypoxia? What's the mechanism of lactulose? What's high output heart failure? Patient who comes in trach and peg and they have pneumonia. Is it community acquired? Is it hospital acquired? What bugs are involved with that anyway? Easily Googleable things that you can use ChatGPT as like a really smart medical student to bounce a conversation off of. Because if I say something wrong, like, hey, we should probably just give vancomycin to everybody, they'll give me pushback on that. Especially like more nuanced things, like is that left to right shunt? Is that right to left shunt? What are those 5 things, like truncus arteriosus, tetralogy of Fallot? What's an overriding aorta? Little things like that. That's good for me to review, because a minority of my shifts are in pediatric. It's good for me to reinforce that learning. And I can immediately bring that to the bedside with residents and medical students. And it lowers the likelihood of some med student saying something like that, like, oh, what are the 4 components of tetralogy of Fallot? And then I have less of a need to do the attending thing and be like, hey, that's a great question. Can you look that up? Because I don't know. The further along I get into this, the more I realize that the attendings who said stuff like that probably didn't know themselves and were using me to reinforce their learning. Okay, have a good shift.